Welcome to Medex Physiotherapy. I am Physiotherapy. I am today explaining on sports injury management, or it is a first aid management of any injury. Any injury takes place in your body and at any circumstance we have to follow minimum. There's a 5 principle. That 5 principle we made it a code word. It is a price. The price means P for protection and R for rest and I for ice and C for compression and E for elevation. Any person get any sort of injury, you have to follow these 5 protocols. The first thing is protect the injured side. It may be injury in the forearm. You have to give a protection by using any cardboard or any wood piece or anything. You can give the support. Available things, any metal piece, you can give a support. That is we call as a protect. You have to protect the limb. You should not do any movement. That is a protection. And next is the rest. You should not do any movements, that is any physical movement or anything to the particular area. That is we can call it as a rest. It is a second principle. And we have to give ice. That's the third principle. I stand for ice. We have to give a cold pack. You should not give any hot packs in case of any acute injury. Any injury immediately after that should not go for any heat. What will happen if you give a hot? If you give a hot, it will be increased blood supply and the area will get swelling will be more, and it will do a secondary damage to the area. That swelling will compress the area and it will produce a secondary damage, and through that the problem will worsen. So that should not go for any hot fermentation or hot pack to the fractured area or any injured segment. Even you may get an injury to the head or the shoulder, any spot in a body. You can go for ice packs. That ice packs means you can also use what you have in your house. Let's say in a refrigerator, ice cubes, you can put it in a cover and you can place it in a injured area where it is a bleeding takes place. It may be it is a internal bleeding or something, that you have to give a ice pack so that it will reduce the blood circulation to that area, so that swelling will reduce and the excessive bleeding will reduce, and it will prevent the secondary damage to the tissues. And how much time you have to give? The maximum we can give up to 10 to 15 minutes of the ice compression. It may be 5 minutes or 10 minutes or 15 minutes is corresponding to the area, and we have to give this ice compression 5 to 10 minutes. Then you have to give a 1 hour break. Then you can go for again 5 to 10 minutes cold pack. That is a very effective phenomena. It will reduce the swelling, it reduces the pain, and it reduces the bleeding. This is one of the major importance in sports injury or first aid of any sort of injury. Next is compression. In case of any bleeding takes place in a particular part, we have to do compressive bandage. It is available. It is in any first aid kit. You have to take that compressive bandage, and you have to if you have to prevent the bleeding, so that you have to give a compressive bandage. Otherwise the bleeding will increase and the patient may lose the consciousness as BPs will go down, and that's why you have to go for a compress the wound area so that we can avoid the bleeding. That is one of the most important. And next is elevation. What is elevation means? To reduce the bleeding. For example, if a person got any cut in a wrist, and what will happen, that's if it is an bleeding takes place in the arteries or a vein, and it may be profusely go off, and then he may lose a consciousness. And for that purpose we have to go for a compressive bandage. Later on we have to go for an elevation. Elevation means the limb should be elevated above the heart level, and that means if a person is a sitting posture, then you have to elevate above the heart level, so that the blood will not move excessive towards the bleeding. And that is one of the most important principle. And these are the 5 principles. Just price protocol, that is a protect, rest, ice, compression and elevation. These 5 steps if you follow, then you can take the patient to the hospital or a concerned doctors for the further management. Thanking you. Please subscribe my channel and please watch updates.